everyone. Happy Monday. Today is Monday, January 10th, otherwise known as National Championship Day. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you an update on the impact of the COVID-19 pandemic on Mobile. Let's see, let me get my reports organized here. So today in our daily report, we're reporting on a cumulative number of COVID-19 cases at 88,728. Yesterday, 458 cases were reported to us. Remember, we see this, cycle going through where, by the time you see Saturday and Sunday, there's a dip in the number of COVID cases that are reported to us, and then it'll start slowly working its way back up this week. I think the thing of note is on Saturday, there were 1,241 cases, so over 1,200 cases of COVID. That was the fifth day in 5 days that had more than 1,000 cases reported each day. So again, just continuing to see record-breaking numbers of cases reported to us. 0 deaths were reported yesterday, and 23 additional people hospitalized with COVID were reported to us. The number in the hospital yesterday was at 185. Again, that number is continuing to creep up slightly. It's still less than what we were seeing on a daily basis back in August and September. But again, we're trying to ask people to please help us slow COVID transmission in the community, to try to keep the number of hospitalizations low, the number of people requiring emergency transportation low, so that we can keep our healthcare system operational and fully functioning. Like a lot of business sectors, hospitals, healthcare, public health, EMS, first responders are all suffering from staff shortages caused by people out with COVID-19. So again, we just want to make sure that we're doing what we can in our community to keep the number of hospitalizations and the other stressors on our healthcare system low. So if you looked at our weekly report, our weekly expanded report, I have to put my glasses on because these numbers are getting quite small. So last week, the week ending Saturday, January 8th, there were 7,495 cases reported to us in 1 week. So that is, again, a record number of COVID cases reported to us in the span of a week. And it is around 75% more than, almost a doubling. So it's quite a bit more than 75%, but quite a large number, and nearly 7,500 reported last week, with nearly 7,500 with nearly 5,000 reported the week before. So an increase of about, around 3,000 cases over the week before. So as I mentioned, the number of hospitalizations is continuing to increase. The number of emergency department visits and other provider officer visits that are attributable to COVID-like illnesses has gone up quite a bit. It's about 12%, so that has gone up quite a bit since, since we were in this lull just before in the beginning of December. So we saw 5 deaths with COVID last week. 1 of those people were fully vaccinated, and the percent positive laboratory results. So again, this is an indicator of how much COVID there is in the community. It was down slightly last week compared to the week before, to around 50%. So that was down 7% from the prior week. So maybe that is a small ray of hope that we may be, at or near our peak as far as cases and percent positive COVID transmission in the community. So I reported a little bit last week on some of the data coming out of the hospitals. And again, this is somewhat unlike what we've seen before, but, we're still early in this Omicron COVID curve. So we're just starting to see, being able to collect data on people who are being hospitalized with COVID and then being discharged with COVID. We get the data on these people once they're discharged. So in the past 2 weeks or so, there have been a total of 235 people who were discharged from hospitals. Their average length of stay was 5 days. Only about 10 or 12% of those who were hospitalized actually required days in the intensive care, and the average number of days in ICU among about 29 or 30 observations was 8. And then a much smaller number of people who are in the ICU who require mechanical ventilation. We have data only on about 11 people, and the average number of days on the ventilator was 13. So those numbers are sort of jumping around quite a bit. When you have small numbers like that, and you have some people with just a very short hospital stay, and then some that maybe are in the hospital for, months on end, it really can sort of, it makes it a little bit difficult to interpret because things can kind of jump around. So, but in general, we're seeing, a low demand for intensive care units and a small number of people who are requiring mechanical ventilation. Having said that, I just really want to be sensitive. I know we all would like for Omicron to be less severe and cause less hospitalizations, but, to those of you who have a friend, a family member, a loved one in the hospital, this is a very serious illness, and our hearts go out to you. So please do what you can to continue protecting yourself and your family by getting vaccinated and getting boosted when you're eligible. Let's see, a couple of other announcements I just want to share. The Alabama Department of Public Health issued a news release just as we were walking into the update today, just talking about that boosters are now authorized for ages 12 to 15. So if you are 12 to 15 years old and it has been at least 5 months since you completed your primary series of Pfizer, then you are eligible for a booster dose of Pfizer. And again, it's within 5 months, not at 6 months anymore, but now the booster is authorized at 5 months. And remember that if you had Johnson & Johnson, well, you wouldn't have had Johnson & Johnson if you're 12 to 15 years old. So just stick with the main message. Again, boosters authorized for individuals 12 to 15. It's already been authorized previously for 16 and 17-year-olds. So now anyone 12 and over can get a booster of Pfizer no sooner than 5 months after completing your primary series, or 2 months after a Johnson & Johnson if you're older, if you're an adult that got J&J. All right, let's see. Very exciting to say today. I think, we have expanded hours at our Festival Center clinic. They are testing over 1,000 people every day. I've heard today that the lines have been extremely long, so please continue to be patient. If you're getting a free test at our facility at the Festival Center, we are doing our best to try to keep up with the demand, but we are suffering from staff outages just like a lot of folks are, so please be patient. But we are returning to offering in-home vaccinations. This is something that we were able to do last spring and early summer with some assistance from the National Guard, and then once they demobilized, we weren't able then to offer in-home vaccination, and we are very happy to resume in-home vaccination for our community. So beginning next week after Martin Luther King Day, so starting, I think we're going to do it on Wednesdays and Fridays. Anyone who is homebound for medical reasons or mobility reasons, you can go to mchdcares.com and click on the Request at-Home Vaccination tab. We're going to be giving Moderna because of the storage requirements for Moderna. It just makes it so much easier for us to do in-home vaccinations with the Moderna storage or the Moderna vaccine, because it is not quite as delicate as the Pfizer vaccine. So we'll be using Moderna vaccine and secondary doses and then boosters when they're ready. So go to MCHD Cares and complete the Request at Home vaccination. We'll start queuing people and getting organized with what parts of the county we're going to go to. So we're not going to start doing it till next week, but we're very pleased to be able to resume that service for our community. I wanted just to say something about hospitalizations. I think I didn't make this point. There's a really good article in AL.com where Dr. Don Williamson, who is head of the Alabama Hospital Association, Had a really good article talking about, yes, Omicron is thought to be less severe, but we're starting to see, sort of the crush of Omicron on people hospitalized, and particularly on children hospitalized with Omicron. So when I look at the 200 or so people who have been hospitalized with COVID in the last 14 days, let's see, about 15% of those are children. And this is quite a bit higher than we've seen with other variants of COVID. So, in the past couple of weeks, we've had 25 children in the hospital, so kids aged 0 to 17. And that is not something that we've seen. And also just remember that, yes, we are thankful and pleased that it's looking like Omicron infections are less severe for most people. But the overwhelming increase in the number of infections is still, going to place a burden, or has the potential to place a burden on our healthcare system. Dr. Williamson noted that, if Delta or a previous variant, if only 3% of those people were hospitalized, then, but you had 12,000 cases, that is still more than if you had 10% of 3,000 people, right? So if Omicron is only hospitalizing 3% of the people who get it, but you have, many more cases, then you still could have as many or more people hospitalized than if you had a more severe variant, but fewer people infected. So sort of a numbers game, but get your calculator out and do some figuring, and you'll see that it might not be necessarily a good thing on our hospitals that are dealing with staff outages. They, need to be home for children. It could get pretty scary here over the next couple of weeks, where we have children back in school for in-person learning. That's great for kids, but we have very few mask mandates. So luckily, CDC has said that the shortened duration of quarantine and isolation applies in schools. So that will hopefully keep kids and teachers in school. But we do expect that it's going to drive the number of infections up, and that it could potentially further stress our healthcare system. All right. All right, there are just a couple questions here from comments on social media. So someone was asking if I could share the modeling data of when Omicron is going to, peak or start receding in our area. So just to comment that, I get this information off of covid19.healthdata.org. That is the IMHE website for all of the modeling that they do. And this is Alabama data, not specific to Mobile, but these are experienced modelers that we've been looking to for 2 years now to kind of help us know what might be coming in the future. I was pleased to see today that according to the models, that we may be at our peak of Omicron cases in Alabama. That's really good news. I hope that is true. But hospitalizations and deaths are not projected to peak for another 3 to 4 weeks. And it looked like the deaths that we could see as many on one day as we saw in August and September, although that curve does not last as long. So it does look like that we're projected to see fewer hospitalizations and deaths overall, but that it may take another 3 to 4 weeks for those indicators to peak. All right. I mentioned, I think last week, about how we could estimate the number of, or the percent of our population who'd been vaccinated, even if they'd gotten a vaccine out of state. So someone wanted to know, how do we get that information? So these are data that are available to the federal government, because every state has their own registry, their own vaccine registry, but they share information with the federal government, and so then the federal government pushes that back to us. Let's see, someone asking if they're safe if they got both shots and a booster. Well, you are up to date on your vaccinations if you've gotten 2 shots and a booster of a COVID vaccine, and how safe you are from that really depends on what other mitigation factors or what other prevention layers that you are applying. If you go out in public, particularly if you're in an indoor setting, we want you to still mask and distance from others. stay at home if you're sick, that sort of thing, or stay away from sick people. But you have done everything you can to be up to date on your vaccination if you've had 2 shots and a booster, but there is still some risk out there because we know that breakthrough infections will occur, and there we'll see more breakthrough infections when COVID transmission is so high as it is right now in our community. Someone asking about, do we see more breakthrough with Pfizer or Moderna? I don't know the answer to that question. Back during some of the Delta and earlier waves, there really was not much of a difference between breakthrough infections depending on what vaccine you got. Let's see, how many people have had both COVID and flu that are hospitalized? I also don't know the answer to that question. Flu hospitalizations are not reportable to public health by law. There's the only flu that is reportable by law to public health are flu deaths. Let's see, someone asking about symptoms of fluorine. I think what they're talking about is Florana, this term that's been made up to refer to someone who has both COVID and influenza. And this does happen. It's probably happening more frequently than we thought. But again, because influenza infection and hospitalizations are not reportable to us, we don't always know when someone is infected with both COVID-19 and influenza, or we might not know if they are infected with with SARS-CoV-2, with COVID-19, and some other respiratory virus. But it can sometimes, the synergy between those, again, because it's not systematically studied, I'm not quite sure if your disease is going to be more severe or less severe. Certainly, you usually will have less severe illness for ILI or COVID if you are vaccinated. So get vaccinated for flu, and that should protect you somewhat if you do get sick, to have less severe illness. And then, of course, we know that a COVID vaccine should prevent severe illness and death if you have been vaccinated. Go ahead, Mark.
Okay. I've had a breakthrough infection. How long should I wait after quarantine and symptoms? Should I get my booster?
Okay, so I think the question is someone has 2 shots, so they're fully vaccinated. They got COVID anyway, so they had a breakthrough infection, and now they're wanting to know when they should go and get boosted. So if you have COVID right now, you stay home for 5 days and then wear a mask for an additional 10 days. So after that 10-day period, you can go and get your booster shot. Okay, that's it. All right, I think we'll stop there today. We probably will do an update on Thursday. It kind of depends. Seems like some of the guidance is starting to get straightened out a little bit. It has been really, really confusing, but here is the take-home message, and it's the same message we had before coronavirus, right? Stay at home if you're sick. If you are sick with a cough or a fever or a runny nose or congestion, fatigue, stay at home if you can. And just as a rule, don't go out if you're sick. Stay at home. So if you can't remember anything else, remember that one.
Do we have time for one more?
I'm sorry?
Do we have time for one more?
Sure.
Okay. Actually, two-parter. Which area hospitals have the new infusion that the Omicron variant is responsive to, Cetrobomab?
So the question is about Cetrobomab. This is the monoclonal antibody that is known to work against Omicron. There are very few doses of Cetrobomab available out there. I don't have my notes on it, but we're talking about not thousands of doses, not hundreds of doses, but in the tens or dozens of doses of Cetrobomab. Likewise, there are very few courses of Paxlovid available. This is the antiviral that can treat COVID-19 that was distributed through Walmarts. There were 39 locations in 39 Walmart locations that got Paxlovid last week, and one of those is in Mobile, And what I heard last week from the state pharmacist is that most locations of those 39 places that got 20 courses, 20. So for a 2-week allotment of Paxlovid, the antiviral, 20 people in Mobile County may get it. So thank you for that question, because it emphasizes that treatment, monoclonal antibody treatment, Cetrobomab and Paxlovid, the Pfizer antiviral, are still in incredibly limited supplies right now. So please don't rely on a treatment to keep you out of the hospital with COVID. Please get vaccinated.
The last one.
Okay.
Urgent care told my daughter to wait 90 days to get the booster after she recovered from her breakthrough December 20th. So you're saying she should go ahead and get boosted?
Yes. So the delay vaccine for 90 days, that's a relic from a year ago this time, where people who were infected would have some immunity or some boost in their immunity, and so we wanted to save vaccine for other people. But that is a relic. We have plenty of vaccine right now. So the only reason that you should not get vaccinated or get a booster is if you were in that 5-day isolation period following infection. Do not wait 90 days to get a vaccine after infection. Okay, I'm getting the all done sign. So whoever you're pulling for tonight, please have a safe celebration by making sure that you're celebrating and watching the game with people who are vaccinated. And if you're not, please keep your distance and wear your mask when you can. All of that yelling and shouting and singing and is, that puts you at higher risk for spreading COVID or catching COVID. So please be safe, and we'll talk to you all on Thursday.